Sickle cell disease is a condition that we get from, like a patient can get it from the parents. So usually if it's the disease, you have to get from the mother and the father. And then when you have the, if I can call it, the part that sickle cell has been affected, that will give you the sickle cell disease. But we also have what you call the sickle cell trait, whereby it's a patient who has sickle cell, but they only have one part of the sickle cell problem. So such people are able to live a normal life. They usually don't have the complications that patients with sickle cell disease usually have. So if we talk about sickle cell disease, what are the symptoms that you'll generally expect to find? So usually around by 3 to 6 months, you have a child who starts crying because of pain, maybe on the fingers, or uncontrollable pain, crying of the baby. And sometimes even the parents don't even know they have maybe the sickle cell trait or the disease themselves. So sometimes they might not really know why the child is crying. So the earliest symptoms that we have from these patients is the swelling and pain on the fingers. Okay, so what we call the dactylitis. Later on, if the patient doesn't have any symptoms, maybe within 1 year you'll have 30% having symptoms. Another 1 year, when they're 2 years, you'll have around 60% of the patients having symptoms, and at latest around 6 years you'll have patients having some symptoms. So the other symptoms that you may expect to find with people who have sickle cell disease is a lot of infections, or this could be like pneumonia, meningitis, urine infections. Okay, so they're more predisposed to getting infections more than other people. The things that we watch out for, especially in the clinics, is infections. So we check like a blood test to check whether they have any bacterial infections. We check their urine to check if everything is okay. So sickle cell disease patients are more prone to eye problems. So every year from 10 years, we recommend them to see an ophthalmologist just to have a look at the eye and make sure everything is okay. The other complications that may arise because of sickle cell disease are like heart problems. So even for that, we work with cardiologists that are able to at least do a yearly checkup, and they're able to confirm that their heart is okay. So what we do on a weekly basis at Houghton Medical Center for the sickle cell disease patients is that we do a general checkup, head to toe, make sure their vitals are okay, their BP is okay. If it is rising, then we're able to detect it early enough. We check are they able to breathe well? Okay, we do an examination, we listen to them and find out if there's anything that has happened within the last week or in the last month, depending on their last consultation. We screen them for conditions like malaria if we need to. We check for kidney problems, so that in case there's a problem, then we're able to get it early on. If there are any complications, then we're able to refer to a specialist if we need to. We work together with Empath, whereby we're able to get medication for our sickle cell disease patients at an affordable rate. And even if they want to do the testing to confirm whether they have a trait or disease, or even just to confirm the diagnosis, then Empath is able to do for us the test at a subsidized cost. So for sickle cell disease patients, usually we have medications that they have to take on a daily basis. So usually if it's 0, or rather from 3 months to 5 years, they have to be on antibiotics, because they're more prone to getting infections. Then we have to put them on prophylactic antibiotics. This is to prevent infections. It doesn't mean that they will be 100%, it is 100% protection from infection, but it does protect them a lot. Our key medication for sickle cell disease is what we call hydroxyurea. This is the most expensive, one of the most expensive medications that we have in the market, and that's why we have partnered with Empath to be able to get it at a more affordable rate for our sickle cell disease patients. The other medications that they have to take is folic acid, because the blood is always on a lower level, so folic is always low in the blood, so usually we tend to supplement that. You'll find a lot of sickle cell disease patients also, their growth and development from a young age to adulthood is always a bit slower, like maybe their weight is a bit lower than usual, and usually we supplement that by one, talking to them about nutrition and good nutrition habits, and two, what we need to supplement is vitamin A, vitamin C, vitamin D, things like zinc or magnesium. Yeah, so we work with them and decide what we need to supplement so that they're able to grow and develop well. Yes, so the main medication usually is the hydroxy that now for Houghton we are able to get it at a subsidized cost from Ampath. Yeah.
Mapon Mukhanji, I'm 27 years old. I was diagnosed with sickle cell anemia when I was a kid. I think in maybe class or unit. Yeah, and I got this I was in primary school. That was on 2008 August. Up to now. The cause is water and that.
So when we saw him 4 months ago from July, the one was from here, was this big from here to here. So at least with time, the wound is reducing, and we're hoping in a short while we'll stop the dressing because the wound will have healed completely. Is that pain?
Not so much.
For sickle cell patients, there are those ones who are more predisposed to getting what we call the leg ulcers. Okay. So these are wounds that are around the ankle joint. Okay. It can be on either side, either this, the inside part or the other side. And there are people, when they have like the crisis, which is one of the complications, then they will have other types of crises apart from the leg ulcers. So different patients have different complications. So if one is more predisposed to leg ulcers, you'll find that that is the main problem most of the times. So it's usually more in men than in women, more in boys than in girls. And a simple wound, it could be, as it says, a mosquito bite, it could be a shoe that is hurting, because like we also have on the other side another one, but it's because it was a tight fitting shoe. So a simple wound can make it just become bigger by the day. Yeah, so proper well-fitting shoes is always an advantage to reduce developing ulcers.
Daktari, can I just ask I don't know if it's a simple or complicated question. Like for the case of a certain rare condition called hemophilia, we have got target places, like the joints, ankles, muscles. Is it same with sickle cell, or sickle cell has different targets?
Usually, like if it's for them, for the pain, when it comes to the pain crisis, for them it will be the back, the chest, the stomach, and the limbs. If it comes to the ulcers, mainly on the lower limbs, where there is reduced blood supply, yeah, so mainly this area is where you have the ulcers. Or if they have what we call DVT, where you have swelling of the leg and blood clot inside, then that also predisposes them to getting the ulcers also. Yeah.
So Michael, can you actually tell me, if I have sickle cell, what am I not supposed to do and what should I do? Like, can I play football? Can I go racing? Can I do swimming? Which type of games will you advise a person living with sickle cell to do and not to do?
For sickle like me, I can't do weightlifting kama hizi za from 20 onwards. This is fanya because nikifanya hiyo sana, nikifanya hiyo tatoka haraka sana. So but I used to play football, basketball, and I used to run also. So that's nafanya, but kama ni exercise it's quite mingi sana. Yeah, but that's some small pain.
Yeah.
Michael, uko na support system nyingine apart from the dog? Kuna friends, family?
Kuna group ya WhatsApp. Kwa
hizo groups mna discuss nini?
Tumo sana about the medicines to take.
Okay.
Need the crisis and tumo sana.
And you tell each other where to go to centers to visit for sickle cell syndrome?
Yeah.
Are there many hospitals like you?
There's a clinic in, I think in Madari. Yeah, kuna moja leo.
Okay.
Yeah, I think kuna zingine, kuna moja Homa Bay, kuna ingine Kakamega, kuna ingine Mombasa, na pia kuna ingine hapa Adams Arcade.
Adams?
Yeah, but hapo greenhouse.
Yeah.
Yeah, kuna ingine hapo pia. So
Ulichagua kuja Hilton kwa nini ukaacha hiyo ya Adams? Why did you choose Hilton?
because I think the best doctors on our the best nursing.
They're the best doctors.
Yeah,
So your personal experience
Yeah.
na daktari
Care.
personal care iko you
yeah, and
Umesomea profession gani?
the art, yeah, in college I also did business management, sikumaliza. I'm trying to join graphic design.
Michael, if you are given a chance to speak to your president sahi, ungemwambia nini?
Ngomba about sickle cell anemia. About sickle cell anemia.
Ungependa kufanyie nini?
Sasa atusikie because the only thing nimesikia tu kwa news ni cancer, typhoid, Ebola na HIV. Hizo pekee ndio ziko. Sijasikia sickle cell anemia kwa TB. So atusikie about sickle cell anemia. And it's going to so many dealing with it. So if you can hear us, atasikia vizuri sana niyo tu.
naweza ambia watu wale wako na sickle cell huko nje.
Stay strong, drink lots of water, and most of it go warm. Wear warm things, and take more fruits and vegetables.
Asante
Asante.
Imekuwa a very good opportunity kuongea na wewe na at least you've let us in into your world. And tunajua utapatia vijana wengine huko nje.
And from the hemophilia part of it, we are actually ready to work together because I know we are brothers of the same blood condition. So I know for the message that tumepatia our president, I'm very sure things are going to change. Na wale watu ambao kuna sickle cell, tafadhali tusijifiche kwa nyuma because this is something that is there. Na si ati tumerogwa, na si ati ni kitu itaisha very soon. Tujitokeze tupate matibabu kwa wingi.